Hi, we're Michael and Shan with Healthcare Genius, and today we're going to talk about our healthcare money plan and taxes. Kind of using our camel analogy as we move through this, the more you pack onto a camel, it's not going to be able to go as far on its reserves because it's going to expend more energy. And that's really what taxes do to your retirement as well as just your working plan. They cause you to not have as many resources to cover healthcare costs or healthcare events that come up.
That's right. They weigh you down. So thank you to the metaphor master over here. But if you don't know, our healthcare money plan, HMP plan, hump plan, that's why we keep talking about camels. So taxes. So healthcare is a unique thing because of all the things that we have to pay for throughout our lifetime. There's a really unique opportunity from a tax perspective that healthcare has, yet a lot of us aren't really taking advantage of some of these tax breaks that are out there. So if you don't know anything about the healthcare money plan, let's start by just why we do it. And essentially our healthcare money plan is so that while you're working and in retirement, you are protected against healthcare events. Anything that might happen to you, you're covered. But it's also so that you are using the most kind of tax efficient path to get there.
As Shannon mentioned, healthcare is unique in the fact that if you work for a company or if you're self-employed and you provide healthcare benefits, those are deductible expenses to the business. And from the employee perspective, as long as the company has what's called a Section 125 plan in place, then what the employee pays or what that employer, self-employed person pays, that can also be done pre-tax, which is big because you're not having to pay state and federal taxes if you live in a state that has a state income tax, but also FICA, which is your Social Security and Medicare tax. So, 30% oftentimes is a starting point for most people that they see savings by having those plans. So that's just traditional health insurance. But there are other plans, long-term care insurance, if your employer pays for it. You could avoid having to have any of that taxable to you as an employee. Very, very key when you're working.
Yep, that's right. And there are even life insurance plans that have different healthcare benefits that protect against catastrophic healthcare events, and those also have tax benefits.
Yeah, they can be definitely tax-free. And then when we start looking at retirement, the things that happen that are different, and this is the big change that people aren't really aware of, is that once you retire, you lose a lot of those tax breaks.
Yeah.
So you're no longer getting that upfront tax deduction. The only tax deduction you get is if you have large medical expenses, and even then you only get that over a certain percentage of your adjusted gross income. So most people pay for that after tax.
I mean, we unfortunately have people come to us when it's a little too late where, most people are getting their health care either paid for or their employer is helping while they're working. All of a sudden they retire, and not only are they paying for their insurance for their Medicare themselves, but then there's this huge tax piece that they didn't even think of. And it can be really, really taxing.
And which is why you need a hump plan.
Yes, which is why you need a hump plan. Exactly. But yeah, I mean, it makes the problem worse, and people don't always realize that it's going to happen until it's too late. But the more you know about your situation, the more you can plan appropriately, and that's kind of what we're here to help you with.
Just to give you an example, to your point, we have a client who actually happens to be in the financial planning space, but primarily works with investments. He turned 65, and he was paying, because his company provides some subsidy for his medical insurance, he was paying about $500 a month for his share. And when you netted that after tax, it was about $280. Turns 65, goes on to Medicare. Because of his income, he's paying some of the means testing costs that we talk about. All in, his net cost on a before-tax basis, $1,200 a month.
Yeah, I mean, he was floored. And he's like, really, I'm a financially savvy person. Why didn't I know this was going to happen? And at that point, that money's coming straight out of your Social Security check. if your Social Security check even covers that much. But yeah, I mean, at that point you're stuck. You don't have a choice. So that's why it's so important to plan appropriately beforehand.
And then I think finally, just to touch on some of the advantages that we use in our healthcare money plan when we're using permanent life insurance, is that you can take dollars out of those policies on a tax-free basis if it's done properly. Mm-hmm. So we use and create plans that allow you to take those dollars out to pay for those costs so that you're not being taxed on that money, versus a lot of people where their 401k, their IRAs, that's what they're using, which in most cases, unless they're a Roth, are fully taxable.
That's right. The last thing that we should probably mention before we wrap things up is an HSA, a health savings account. If you're not already using one, make sure that you max it out if you can, and don't spend it until you're retired, until you have to. That's a phenomenal way to plan. But unfortunately, the real issue there is not everyone has access to that type of account, because you do have to have a high deductible health plan. And that unfortunately healthcare costs in retirement are so astronomically big, and they are just getting more and more expensive, that sometimes an HSA, even if you do all the right things, doesn't always cut it. So little tip we have, but that's one of the reasons that we have our hump plan, is it's usually not enough.
Yeah, and the HSAs are great programs, you're right, Shannon, but a lot of times people just can't contribute what they want to into those plans. So
yeah. All right, well, thank you guys for watching. Now that you know a little bit more about why it's so important to plan appropriately, we hope that you take the time to look more into our hump plan, HMP plan. If you want to learn more, feel free to watch our other videos. Make sure you're subscribed to our YouTube channel so you know when we come out with new videos. There's actually a little bell next to the subscribe button, and that'll notify you when we come out with new stuff. And if you're ready to just dive in and you want to become a client of ours, you can do that in the description below. Thanks again for watching. It's Shannon and Michael with Healthcare Genius.
stay healthy.